Hey, good afternoon. Wanted to begin by letting you know Supervisor Greg Cox is not able to be here today. He had a family emergency. We do expect him back on Monday, and we wish him and his family all of the best. Second thing is we have a little change in our format today. We essentially have two different press conferences that are going to happen back to back. Myself and Dr. Wooten will be providing an update on the coronavirus response. We will then be taking any COVID or coronavirus-related questions. At the conclusion of that, Sheriff Gore will be here to provide an update on the law enforcement situation, and then the sheriff will be here to take any law enforcement-related questions immediately following, and we will run the two of these back to back. We've talked throughout the process that our reopening would be in phases. We would take a step, monitor the impact daily, track the numbers and metrics, and in particular the triggering entities, which we've shared with you. If we see success, then we'll be in a position to take an additional step. It was just a week ago, this past Tuesday, that we amended the public health order to take a step on beaches, where we freed up the ability to sit and sunbathe on beaches using chairs and towels with members of your own household. We have worked with our coastal mayors and lifeguards and city managers, and it appears that that implementation has gone very well. People are maintaining physical distancing, and they have been able to enforce that. And because of that progress, we are prepared to take another step as it relates to beaches. This will not go in effect until next Tuesday, June 9th. Some folks ask why Tuesdays. The cities and lifeguards have asked to get through the weekend. They want to use Monday to update their signage and prepare for the implementation. And then on Tuesday, it will be in effect. But we will be amending our public health order that will allow, we do not require local cities or state beaches to do this. It is their decision to implement it, but they will be able, if they choose to change their posture around beaches starting Tuesday, June 9th. And I believe we have a slide representing these changes. You can see right there. So starting Tuesday, June 9th, local jurisdictions are free to open their beach parking lots and allow active sports and active recreation with household members only. Again, the local jurisdictions, the cities and state beaches and parks will decide when, and they can decide exactly how it is they want to do. They can be more restrictive if they choose, but the county public health department is removing any of these restrictions on beaches going into effect Tuesday morning, June 9th. The second part of our guidance, which we talked a lot about, is, let me take that slide down. The second part of update around reopening certainly surrounds our efforts around reopening our businesses. The governor, again, has consistently said we will move in phases. We will take a step, monitor the impact, and be in a position to take another step. The governor also has provided greater latitude over the preceding month to counties in terms of making determinations. We've covered with you many times in the recent days the state would put out guidance, and once the guidance was socialized, it would be up to counties to decide when exactly they would like to implement that. We have received word from the state of California that at some point today, perhaps later tonight, they will be releasing a series of guidances around new industries and new entities that will be allowed to open at the county's speed no sooner than June 12th. And so I'm going to share with you now what those guidances are that we expect to come out today, hopefully tonight. There would be guidance around gyms, around day camps. We believe there will be opportunities to include some youth sports activities, possibly into the day camp criteria and framework, guidance around campgrounds, hotels, card rooms, family entertainment, bars and wineries, zoos, indoor museums, film and TV production, and professional sports. Again, we expect this guidance to come out from the state of California today. Again, it would be moving no sooner than June 12th. But that gives these businesses and industries about a week to look at that guidance, look at our safe reopening plan on our county website, and begin the thought process to prepare to move no sooner than June 12th. Over the weekend, we will evaluate the guidance that comes out, continue to monitor our situation, and we think we'll have more updates throughout next week around the timeline for when we'll be able to do it. But again, another positive step for our region moving forward. Now we'll jump into our daily updates from today. Today we're reporting our single highest day of testing throughout the coronavirus pandemic. I want to preface it by saying we had a kind of dump of results that represented a couple days. And so even though we're at 5,936, it does not mean we will be at that number every single day. We are working diligently to increase our daily reporting totals, but there's always going to be day-to-day fluctuations in the numbers. But our 7-day average is now over 4,000 at 4,345. And we have some challenges with the state test reporting system, and so we're working through a number of those, but we expect our daily testing numbers to continue to increase. But again, today we're reporting our single highest day total in testing. Contact tracers are now at 431, getting very close to that goal of 450. And then you see our public health motel rooms that are available for treatment. Along with and consistent with our single highest day of testing, today we're reporting 240 new positive tests, which is our single highest day of tests. But again, it's really important to put the number of positive tests in the context of the total tests that were done. And so as that relates, it is only 4% percentage of positive, which is a little bit higher than our 14-day rolling average, but not presently a cause for alarm. Same percentage positive as we had yesterday, 1 percentage point higher than the days before. But again, you can generally see that 14-day rolling average holding reasonably flat and steady as we move forward. As we continue to see more tests being done on a daily basis, we expect to see more positive results. And again, the important indicator there is the percentage of positive, which tells a more complete picture than just the number of positives. Our daily hospital census, again, is holding reasonably flat, 153 in ICU, 379 total ICU, a few less than yesterday. Total COVID hospitalization, a few more than yesterday, but again, you can see over the last month holding relatively stable and flat. Next, we're going to look at our ICU bed capacity. We had a little uptick in the non-COVID ICUs, which made our ICU bed capacity jump a little bit to 71%. Again, one of our triggers is 80%. There are some day-to-day fluctuations you see here. You can see the ICU holding flat as it relates to COVID, and a slight increase yesterday to today, which accounts for the uptick in the percentage being occupied. Certainly something we will keep an eye on. And then my final chart for today is just the total hospitalization. At the bottom there, you see the ICU COVID-related patients, and then in the blue, you see the non-COVID-related patients tipping just over 4,000, but more than 800 beds short of that 80% capacity, which is also a trigger that we assess and use. As we head into the weekend, we really want to encourage everyone who is out for any purpose to please exercise caution. Please utilize face coverings, utilize physical distancing as best you can. We want to continue our forward progress. We have done really well as a region. The numbers have been reflective of our efforts and the intentional focus and steps we've taken. And so we definitely want to make sure that we stay in a posture and position where, based on the triggering metrics, we can continue to reopen, and we want to do that smoothly. And so we again encourage everyone who is going out this weekend to please exercise as much caution as possible, utilizing face coverings, physical distancing where you can, hand washing, and then, of course, for those folks going to work, the temperature screenings for employees. With that, I'd like to turn it over to Dr. Wilma Wooten for her Public Health Officer's report.